Hi, everyone. I'm so excited today to be speaking with Dr. Thorsteinson. Dr. Thorsteinson is a general dentist in the Atlanta area. She received her Doctor of Medicine in Dentistry from Augusta University. Her practice, Wellspring Dental, offers patients functional general dentistry care, including airway and sleep health with whole body wellness. Shannon is a leader in the functional dentistry community and is passionate about women's health and giving back to the community. She's an accredited provider by the IAOMT, which is the International Association of Medicine and Toxicology. She's an affiliate of the Breath Institute and a fellow from the Academy of General Dentistry, as well as a master from the International Congress of Oral Implantologists. I personally have had the pleasure of working with Dr. Shannon and her incredible team at Wellspring. I always love our conversation, so I'm so excited to get to share it with everyone today. Thank you so much for joining.
Awesome. Thank you so much for having me, Brian.
Course. So I guess just to get started, can you tell us a bit about your background and why you decided to name your practice Wellspring?
So I'm a general dentist and I've been in practice for maybe 12 years now. And the last 4 or 5 years transitioned more to a functional integrative approach. So really it was this gradual process that just evolved over time to the point that I just wanted to be able to create everything from scratch, from the way patients came into the practice and the types of patients that we were wanting to see. So for me, Wellspring was the word means an abundant source of something. And I want this practice to be an abundant source of connection, of healing, and of knowledge and innovation for patients in our community. So it's just sort of a grassroots, if you build it, they will come type of place. I've been so grateful that that's really been the case. It's been so great to connect with people I didn't even anticipate being able to connect with and being this place for like-minded people to gather. It's been great.
As we've talked about in the past, I always love these conversations because you bring such a wealth of knowledge within dentistry, but also going above and beyond for your patients, which we'll get into. But I guess to start, what initially attracted you to the dental space and to the oral health space?
Well, it was a combination of things. I was in middle school in South Texas, where we lived on the Mexican border, and there was a shortage of healthcare providers there. So there were a lot of educational opportunities in our specifically high school setting that encouraged young people to go into healthcare careers. So I was exposed to a lot of different options. And what I liked about dentistry, I also had braces at the time, and my favorite subject was geometry.
Mm.
So I thought that moving teeth was a really cool application of geometry and angles and movement in a practical way. And it really allows people to combine science and artistry. It allows people to have their own business. And so that's kind of what originally attracted me to dentistry. And then when I was in college at Georgia Tech, I studied biomedical engineering, and I was part of a research lab that did bone grafting research, because what was so
Mm.
cool was that there was a lot of research going on that research was being used in the orthopedic spaces, but the mouth is actually a much more accessible area to test materials initially. And so many of those kind of bone research projects had this dental application. I had some really great mentors to help me kind of see those connections and learned a lot.
That's awesome. And that was something I've always found really interesting is that you have that background in biomedical engineering. And I feel it coming through when we're discussing different applications and different treatments and things. How has that influenced your care? How do you, I know you just touched on it a bit, but how do you bring that type of thinking into the practice at Wellspring?
You know, I say I'm not for everybody. I have kind of an analytical approach and background. So I think what that means is just it's part of my personality. I really enjoy a lot of data. I enjoy a lot of information to take into account when we're treatment planning for patients and understanding and getting to know them for the first time. So, and a lot of what I do, I try to have it be as data driven as possible. And that's a lot of where I've loved connecting with you guys, because saliva testing really offers that in a really tangible way for me and the patients to see. So I enjoy being able to have pre and post data. I enjoy being able to get baseline information for patients just to help us make decisions and individualize care.
I love it. And we'll definitely be coming back to salivary testing. And it's a great lead in what you were mentioning in terms of, gathering more data and taking more of this comprehensive approach. I think there's a growing awareness of functional medicine in the general population, but maybe less so functional dentistry. So can you tell me a bit about, or tell us all a bit about what functional dentistry means to you and how it differs from conventional dentistry or complements traditional dentistry?
Yeah, I mean, to me, it's just taking some additional steps. The mission of our practice is to help our patients lead a long, healthy life. And we don't want anything about the mouth to compromise our health. We don't want the mouth to be a risk factor for our health. So, what that means is we look closely at the connection between the mouth and the body. And I say to patients that every tooth is actually an organ. It has blood and nerve supply that comes from somewhere and it goes somewhere else in the body. So we don't want to think of the mouth as this totally separate entity. We want to think about the impact that our body has on our mouth and vice versa, and the impact that the work that we do, what effect does that have on the body? So we're really trying to dive into those connections, and more technology and research helps us do that in different ways all the time. So it's exciting. And it's an exciting time to be in the field.
That is really exciting. And I guess, we often hear people who are very interested in trying to offer more of that type of care or bring in more of that oral systemic connection into the practice or into their patient care. But sometimes we get questions of what that looks like practically. So I guess one question is, what would a visit to, as a patient, how would my visit to Wellspring differ from maybe a conventional dental visit?
Well, I don't focus a ton on what other practices are doing because I may not be able to speak to that specifically,
Fair.
but I like to highlight what we do.
Yeah.
So in our practice, what we do is we like to first get to know the patient. Of course, we're gonna do all the normal things that you would typically think of. We're gonna get x-rays, we're gonna check your gum health, we're gonna look at the dental work you currently have. But I like to start with the base level of we're going to look at inflammation, infection, pain, cavities. We're also going to consider toxicity of materials. We're going to see if there's anything in the mouth that may be compromising our health or something that we want to just pick a different option there. And then we move on to other things, right? We just go in these phases as we build trust, get to know the patient, get to know their body over time. The next step that we like to focus on is what's going on with our bite? Are the joints, the muscles, and the teeth working in harmony? Are we sleeping well? What is our sleep quality? Long term, how does that affect the longevity of the teeth and the oral health? And then aesthetic concerns, of course, after that, once we've built a healthy foundation. So, things that I'm excited to be able to offer with our new patient exam that are unique to our practice. Every patient gets a microscope slide. So we take a sample of their saliva and we look at it under a microscope to see the shape and concentration and movement of the pathogens and bacteria present. And then we also are doing a saliva test for all new patients. And we are doing an analysis of their bite for every new patient with a digital scan. So those are things that may be unique, but it's something that allows us to give a comprehensive approach.
And I love it. And that was one of the things I've always really appreciated in our conversations was when you spoke about your ethos behind Wellspring. It really was, I'm going to set out to deliver the best standard of care as I believe I can offer it to my patients. And that is the only driving force behind it. And it comes through and you ask the great questions about bristle testing. And I learn so much every time because, when you have somebody who's so passionate about that mission, I think it's just infectious to want to learn more about it. You touched on the oral systemic connection for patients, or really understanding. I love that idea that every tooth is an organ. What other ways do you go about educating patients about that oral systemic connection?
Well, it's important to me to have that really detailed new patient exam. And It's a 2-hour process. And honestly, sometimes it takes longer because I tell patients I want to get a really good idea of where we're starting. I want to get a really good baseline. And I don't want to miss something important the first time we meet because it's when I'm dedicating the most time to really dive in, right? And it's when I'm really having everything in front of me at one time to get the best view. So that's part of with the oral systemic link. I tell patients that I really wouldn't know certain things about your health if I wasn't doing these extra details like the microscope slide and the saliva test, because you can't know these things just by looking, even if we're doing a really great clinical exam. And so it's kind of something that evolves and will continue to evolve.
Yeah.
But I compare, for example, saliva testing, I compare it to blood tests that like you go to your physician and they're going to draw blood so they know about your levels, but they wouldn't know that just by taking your blood pressure, right? So we are trying to get to that level of really using sophisticated data and testing to understand more. And we're still in the space of learning what that means and how to navigate that. But I think that's part of the fun, right?
Yeah.
But I tell patients that I want to know your status for your bacterial risk because there's so much information that we know linking certain pathogens to certain systemic conditions. And as part of our mission to help patients lead a long, healthy life, I want to know based on, of course, family history, clinical presentation, but also microbial status, what are these risk levels and how do I want to customize the treatment for you? And the main things that we talk about just as the basics are, I want to know if you've got risk factors for heart attack, stroke, diabetes, Alzheimer's, cancer, fertility issues. And these are kind of the big ones that I talk about and I genuinely just want to know because then we can customize a plan to say, well, how are we going to minimize this risk from an oral health standpoint, knowing that it's just one factor, of course, but it makes me feel good that we're really providing comprehensive care and doing the most that I can to impact the actual health of the patients. I tell them, of course, if you have a cavity, we can fix it. If we have a broken tooth, we can fix it, but we can do so much more.
Yeah, I just keep smiling at these answers because I think just coming from the patient side, it
Uh,
is such a difference in the messaging and just the approach. And, you know, I think we're all becoming much more aware that all of our systems are connected. And so the more we can break down these barriers or these silos between professions and between different areas of our health, that's why I always get so excited speaking to leaders like yourself who are really on the forefront. And I think, patients are becoming much more knowledgeable about their health too. So getting access to that information and getting it from a trusted source like yourself, I know is just leading to better outcomes.
well, what's so cool too is that our patients come really educated and our patients come really knowledgeable and already knowing a lot about this stuff. And they come in saying, I want to know about my risk levels. I want to know my status and I want to take active steps towards bettering my health. And not just patients, but practitioners too. And like we talk about those silos, and that's part of what I love about a functional integrative space is typically it attracts people who do want to go that extra step to connect and understand and knowing that they play just one piece of a bigger puzzle and having this place has sort of been able to foster those connections where we've had people come. I mean, what we work with so many different specialties, so whether it's physical therapists wanting to connect, integrative med docs, cardiologists. One of my favorite things is to work with a patient who's already on their journey, right? And they're doing all these really great steps towards their health, but there may be something that we've not really seen enough movement on and wondering why, right? And so sometimes it's that oral health link that's that missing piece that we've not really been able to connect yet. And there are so many, especially I'm grateful in Atlanta. We have a lot of great resources here, a lot of great practitioners that are super knowledgeable and collaborative. So a lot of our integrative med colleagues know and they say, okay, well, I've done this. Next up, go see Dr. Shannon. And they're coming to me, these patients who may have been struggling with repeat heart attacks. And to me, that's one of the most impactful groups of people to work with because I've had competitive ballroom dancers, I've had marathon runners, come and they're saying, look, I'm doing these things. I'm healthy, I'm exercising, I'm eating well, but we still have this health challenge. What is there something else that we can look into? And it's been really interesting and profound to help watch these cases improve.
That's incredible. I
Mhm.
think I hadn't heard that story before, so that's super cool. And it really just highlights this missed opportunity I think we've had in healthcare of really having dentistry and oral health be that extension of primary care and of the care team when
Yeah.
patients are thinking about their total health. Generally seeing these patients twice annually or at a regular cadence. So it's so awesome to hear in the community, some of those connections you've built to really make that seamless transition across the healthcare for patients. So
More and more all the time. Trying to connect more and more all the time.
I love it. And hopefully this can help too. And so I guess building off that, can you tell me just some of the other trends in dentistry or in the oral health field that you're excited about?
One of the things that, I think the two big things that are really changing how we practice as a field are saliva testing and the ability to 3D print metal. So this is something that we do a lot of work with sleep and airway health, improving breathing with patients, and that involves work with orthodontics as well as tongue ties and myofunctional therapy. And it's sort of, but again, super impactful work. So even 5 years ago, the types of appliances that we were using to get the mechanical forces to develop jaws and move teeth weren't as sophisticated as they are now. So we're able to really customize shapes and have really strong materials that can do things that just weren't possible 5, 10 years ago as far as developing jaws. And I think we'll see more and more innovations come out of that space as well.
That's really exciting. I think, you know, I've started to hear more folks talking about mouth taping or about nasal breathing, but it really seems airway issues are another opportunity where we can really advance our care and advance patient understanding. And I know it's a big emphasis at Wellspring is, as you mentioned, getting into airway issues and really helping patients. And you can clearly hear the bioengineering degree coming through with the approach, how you focus on it. But what initially got you interested in airway health and its importance to our oral and overall health?
And it's such a rabbit hole for everybody who's in that space. But I mean, the initial impetus was probably a few things. I mean, I just happened to take a class, sign up for a class that I didn't even really know what I was getting into, and it totally shifted everything about how I practice. It was a course by Ben Moralia and pediatric airway. And this was like my first introduction to the topic. When I was in that class, it also helped me connect things about my family. And my son was having some speech problems at the time. He was a toddler and kind of learned more about that. And I said, gosh, we were able to find good resources here in Atlanta for us to help address things in our own family, but it was not an easy process. And so I said, oh my goodness, I'm an oral health provider. I didn't even know about this and I didn't even really know how to navigate it very well. So it was something that made me really want to dive more in because I said it's got to be hard for people who are not in this field to navigate. So let's see what I can do to dive in there. And so that sort of started things, and then it's been a super deep dive ever since, and continues to be. But it's also really, I love when we can kind of treat the whole picture because we sit down and we do reviews of patients with their saliva test and their x-rays and their medical history and their clinical exam, and we kind of put things together and we say, well, what risk factors are present and what recommendations do we have? And a lot of times we are recommending that we get more information about their sleep status and their breathing status as one of the risk factors for inflammation and bacterial burden. So those are things that are connected. And I love when we can sort of be working on both with patients. So, yeah.
That's awesome. And airway was or proper breathing and mouth breathing was one of the first signals for me of how much I had to learn about oral health first getting into
Oh,
the
yeah.
space. I had struggled with decay issues and I had thought it always basically was tied to diet or was tied to not brushing enough or not flossing enough or something in the hygiene routine, not realizing that mouth breathing was such a high contributor to decay and what it can
So
lead to in dry mouth. And, as you mentioned, once you learn that, you start going down the rabbit hole of realizing oral health is so much more complex than I think the 2 minutes a day people generally think about it. And there's so much more we can be doing to really improve these chronic issues and keep elevating our care through the oral cavity.
it's something that we find a lot of our patients come in asking about and wanting to learn more about and are hoping to get help with our approach is that it can be really frustrating, especially we see a lot of kids. It can be really frustrating when we're dealing with these decay issues. And we see it all the time where families are, look, we're brushing, we're flossing, we're not eating a lot of junk food, we have a healthy diet, and these our kids are struggling with the cavities. What's going on? And it's frustrating if we're only focused on, well, we need to brush more and floss more, and we'll see you in 6 months, right? It's frustrating if that's the only guidance. And it's not easy, and it's not that we have all the answers, but we're
Right.
trying to dive in and look at some of the root causes. And two of the big ones we're trying to look at when we have these cavity issues, especially with kids, are what's going on with the gut health, what's going on with our vitamin D status,
Mhm.
and what's going on with our airway and breathing. Because of course, if we're breathing with the mouth, we're going to have more dry mucosa. We're going to have a totally different bacterial profile. And we're not going to be as able to naturally clear our food with our tongue and our saliva. And it's just going to put us at higher risk. We're going to have a higher pH and put us at more risk of cavities. So, what are the things that we can do to work towards improving? So, I mean, a lot of times we're going right from, okay, we're going to deal with the issue at hand. We're going to work on, of course, fixing or addressing the cavities. But then what are we going to do about these root causes and start working there?
I love it. Getting both the preventative approach and restorative. So,
Yeah.
is that addressing the acute conditions, but then ensuring we're on the path to stable health.
Right.
And staying on airway for a minute, one of the things that I was really surprised to learn, and I was reading this recently, that an estimated 20% of adults in industrialized countries can experience sleep apnea, but the vast majority are still undiagnosed and untreated. I'm curious just what you think might be contributing to some of these high rates of sleep apnea or airway issues.
Well, this does get into some of the rabbit hole stuff, but it's a topic I enjoy. So for me and what I've studied, we know we go back to anthropology to kind of answer that question. So we're looking at the skulls of how we developed and before our modern diet, before we had the ability to process food, before the Industrial Revolution, we ate differently. And we can see that change over time in the shapes and sizes of human skulls. So, however, we have the same number of teeth. So even though our jaws are getting smaller, it really ends up pointing to what's happening with our breathing and sleeping. So we eat a softer diet than we used to. And so what we call it is generational nutritional deficiency that has led to the decrease in the jaw size. That in itself, then the roof of the mouth is the floor of the nose. So it impacts our ability to breathe and sleep. It's less space for our tongue. So our tongue doesn't fit as well in our mouth and then has to go to the back of the throat, further compromising our airflow.
Mm.
So these are things that really are endemic in our population, just based on how we've been eating for generations. And what's tough is we're trying, right? We're trying to make all these great choices. There are lots of things that we can do early in life to get good growth. But regardless of any of those interventions and efforts, we're all sort of starting off behind the eight ball. There's a lot of course, genetic factors, but also epigenetic factors about our environment for how our anatomy is going to develop. So, something that pretty much I find most patients could benefit from some kind of intervention or help because there's really no aspect of our health that isn't improved from better sleeping and breathing.
That could be a whole, I think, another episode on itself. I'd love to go down those rabbit holes because I can just hear how much more is behind all of that. all those statements, but that's fascinating. And I guess for people listening, what are some symptoms or warning signs or, just early signs that we should be aware of that might warrant a sleep study or paying a visit to someone like yourself?
So in general, some of the things I like to talk about are, I mean, sleep should be quiet, still, and dry. And so we're looking for, whether it's kids or adults, we're looking for teeth grinding, we're looking for bedwetting, we're looking for leg movement, drooling, sweating, and of course, snoring. So those are things that, sometimes it's interesting because these are things that are just really so common, right? And we kind of laugh about them too. And it's funny, right? Like it's funny if your uncle snores and falls asleep in every movie, and we kind of make light of it. And of course, we don't want to scare anyone. We don't want to over diagnose, but it's important to think about what impact is that having on our health, right? That's not quality breathing or sleeping. Some other part of the body is going to be affected. So really, it's just because it's common doesn't mean that it's healthy. And the good news is there's so much that can be done. We talk about with patients, are we trying to prevent, control, or resolve these sleep or breathing issues? And the first step is just identifying, right? Like, let's start to ask questions. Let's start to observe. One of the first things I love families to do is just make a video of them sleeping, because the reality is we don't really know about the quality of the sleep unless we look and unless we test. So just because maybe a child doesn't wake you up at night doesn't necessarily mean that the sleep we're getting is quality. So it's just about gathering information first, and hopefully there's nothing going on, right? But we don't necessarily know, just like saliva testing or getting a blood draw or taking a blood pressure. It's not necessarily something that we would really know our status unless we're looking into it further.
Incredible. Thank you. I, I'm going to be re-listening to that answer because there were some good, I think, things to just pay attention to in there. Some signs that I hadn't even known about, like the leg movement or the sweating. So those are really good to know. And I had to bring it back to salivary testing, and you've
Mhm.
mentioned it a couple times here. As I mentioned, I've had the pleasure of working with you in offering salivary testing at your practice, specifically bristle testing. Can you tell us a bit about how your team uses salivary testing and how you leverage that information in the practice?
So it was something that, I mean, it changed over time. At first, we would sort of just test when we saw certain risk factors, right? Like a certain number of bleeding sites or bone loss, or like a indicator to us that there was a problem. But the more and more testing we looked at, the more sometimes I was surprised by the results, right? Like I thought I would expect a test that was concerning in this patient, and I thought this patient would have a totally fine test. And what ended up happening was, like, I really wasn't able to predict that super well, that I was surprised a lot by the results that came back. So I said, okay, so this is not necessarily completely correlated with clinical presentation. So I just need to test everybody. So that's how that evolved, that, okay, I'm getting baseline. And then what we do is we sit down once a week to go over the tests that come back, and we're cross checking that with x rays, clinical presentation, measurements, and bite, any other information we have about the patient, and then giving recommendations on where to go from here. Are we going to talk about probiotics? Are we going to talk about seeing you more frequently? Are we going to talk about other types of interventions that we may want to do? And I'm really excited about our hygiene program in general. I think it's a really sophisticated department and protocols that we have, where we do guided biofilm therapy on every patient, and then we're disclosing the plaque and bacteria to understand visually what's happening to reinforce oral hygiene at home. We are utilizing ozone a lot of the time, which is electrically charged oxygen, and we can use laser therapy as well for things that to just help create a healthy oral microbiome and help create balance in our system. And we tell patients, look, the mouth is just the first entry point to the gut health, right? So
Mhm.
ideally, we're working with a functional med doctor who's also looking at gut health as well. And then we're kind of taking this two-prong approach, because we don't want just working on one area and then not making progress. So ideally, it's really really both. And then discussing other risk factors. Do we want to go get some cardiac screening? Do we want to go get an airway screening, sleep screening, do some blood work? A lot of times, again, vitamin D and ferritin are things that we're collaborating with practitioners about frequently. And so we're trying to then decide how often that we want to test a patient as well and say, because that status can change. One of the other things we talk about going back to the cavities is also, are there undiagnosed cavities in the family? So these are communicable bacteria. And sometimes we may not really think about that. We might be prioritizing like our children's health, right? Let's make sure we're staying on top of their appointments, but mom and dad are busy, right? And sometimes our health kind of falls by the wayside and takes a back seat. But that in itself may be compromising the health of the children too, passing those bacteria back and forth.
Mhm. And so many of the good points in there of what we generally are talking to with practices about salivary testing, about how it's really the goal is to offer you more information that you
Yeah.
can, as you mentioned, marry with the other clinical exams you're doing, the other types of information you're collecting to really get, is it directional information or is it root cause in this patient? The more information we have. And so, yeah, I think where the rubber really hits the road with salivary testing is when it's in the hands of practices like yours and other practitioners where you can take that information, marry it with all that other great information you're collecting, that patient history that you're collecting to really make those insights meaningful and actionable for patients.
What's cool about the bristle testing in particular is also that we have information about commensal bacteria and information about various categories, because sometimes the chief complaint or the main reason a patient came in might vary, right? Like a lot of times they'll come in asking about bad breath, right? And that's a specific line item in the bristle test. So it breaks it down in a way that's easy to understand and detailed as well.
That's great to hear. And yeah, and we're constantly trying to improve it, and feedback from people like yourself has been instrumental to really getting there. So I want to be mindful of your time. You've been so generous, and this conversation has been incredible. For people who want to learn more about you and about Wellspring, can you tell us where they can find more information?
So we can follow us online. Our social media handle is at Wellspring Dental ATL for
Mhm.
Atlanta. And our website is wellspringdentalatl.com. There's a lot of videos on our website and a lot of information on our social media. And we love to connect with patients.
Awesome. And we'll include those links in the description as well. And just seconding that recommendation to go to the website. If you're in the Atlanta area, of course, go check. Even if you're not, as Dr. Shannon mentioned, there's so much great information and resources there to learn from. So highly recommend checking it out. Shannon, thank you so much again for making the time. Conversation was even better than anticipated. So really appreciate it.
Always enjoy talking to you. You guys are a wealth of knowledge at Russell. Thank you so much.